If I can get as many new patient leads into my clinic for anything that they need help with, it's surely going to be the best way to grow my clinic. Is it? Well, maybe it's not. In fact, maybe you don't even want to grow your clinic, and the thought of getting more patient leads in the door is frankly frightening, because you can't even keep up with the current demand for all the things that people are coming in to see you for. In this video, I'm going to talk to you about why getting as many leads as possible into your clinic may not be the best idea for you. Tim Lumsden's my name, from Tim Lumsden Online, helping healthcare clinic owners in areas such as physiotherapy, osteopathy, and podiatry with marketing solutions for their clinics, so that you don't need to worry about it yourself, and you can focus on doing what you do best in your clinic as it is. So let's start by talking about what's wrong with getting as many patient leads in the door as possible as you can possibly serve. Generally speaking, this is going to mean that you will see people for all different kinds of conditions. Some of these conditions may be interesting for your practitioners. Some of them may be more routine and frankly not that exciting to treat. Some of the people who come in to see you might be for really interesting cases. Or it may be that the people who come in to see you need really intense treatment, and if that's the case, it's going to result, let's be honest, in a higher profitable patient for you, compared with someone who may come in for some routine work, which, to be honest, is not going to result in a high long-term value patient. So by attracting as many patient leads into the clinic as you possibly can, it's likely that you're going to attract a lot of patients who aren't that profitable for you. So what's the solution? Well, you can just say, stop, I don't need to actually get any more patients in the door, especially if you're extremely busy as it is now. And if you are extremely busy, I'm willing to bet a lot of that is going to be made up of patients who are not that high value. So to not market the clinic in those times is not a good idea. And likewise, to not market your clinic in a time when you want to grow your clinic is also not a bad idea. In fact, it's a great idea, but doing it the right way. And this is about attracting or getting new patient leads in the door that are considered high value in terms of the treatments that you can offer them. And these treatments and these patients, that come in are normally people who genuinely need your help, who need that intense treatment. So we're talking about treatments which cannot be done on the spot and will need to come back for multiple sessions to get the best outcomes for them. Not only that, these types of conditions tend to be the more interesting cases for your practitioners, which keeps them happy as well. Further to that, you also can position yourself as the leader in your area for those particular high profit or high value treatments for your patients. So as an example, in podiatry, it may be for heel pain. So heel pain may lead to, say, treatments in shockwave therapy or orthotics, that kind of thing, as opposed to someone who comes in to maybe get their nails clipped. If you're in physiotherapy, it may be that you can help people with knee pain, and by coming in for one session is very unlikely to actually solve that pain. Therefore, a series of sessions, maybe over 8 to 10 sessions, is what's going to be really needed to get the best outcome for that patient. And therefore, they're going to be a lot higher value than someone who just comes in for a one-off. Maybe you want to see people for back pain, because people who are in back pain are really, really in a bad way, and to get them the best result, it's not just about coming in for a single session. It's about them coming in, for multiple sessions, so you can really get the best outcome for them. That then keeps your staff happy with interesting cases, and also keeps the right kind of patient coming in. So as you can now appreciate, if you're trying to market your clinic to get as many patient leads into the clinic as possible, it's not going to be a good idea, because you're going to attract a lot of low value type patients. And also, it's also a good idea to shift away from those low value patients, if that's what you want to do, and focus on marketing towards the high value patients in situations where the clinic's already full. Because what it's going to do is reduce the caseload of low value patients, and increase the high value patients, which means you'll probably see less of them and make more money, which is what you need to do because you're running a business, of course. So there's your reasons why marketing your clinic to get high value patients is always going to be a great idea, compared to trying to catch everyone that you possibly can. Now, you may have seen campaigns or ads on Facebook where clinics are offering for patients to come in at a discounted rate to see if physiotherapy or osteopathy or podiatry can help them. But that does have that effect of capturing everybody, as opposed to calling out and helping people with specific needs for specific high value conditions. So I hope this video has been helpful. I hope this video maybe helps clear up a few issues that you may be having in your head about how marketing may be able to help your clinic, and how you can either grow your clinic, even decrease the number of cases that you're seeing for routine work, and increase high value patients.